Hello, I'm Dr. Stephen Castor. I'm the Chief Medical Officer at Menorah Medical Center, and I'm your host for House Calls, which is a show that we have where we interview physicians from Menorah Medical Center about topics that are important to our community. Today we have with us Dr. John Tann, who's a board-certified general surgeon and fellowship-trained bariatric surgeon, who's here to talk about intermittent fasting.
Great
Welcome,
to be here.
Dr.
Thank you.
Tann. Nice to have you. So intermittent fasting is something that a lot of people have been reading about and hearing about, and I know you've done a lot of research personally about it for you and your patients. Can you tell us a little bit about what that is and what are some of the benefits?
Yeah, intermittent fasting is one of those things that when everyone's looking at something to do, they're trying to find diets and exercise. It's not diet and exercise. It's a lifestyle modification. And that's why it works well. It's because it changes your body's metabolism, increases certain hormones, decreases other hormones, and does some different things that we don't just see in diet and exercise. So there's a bunch of research that's been out, maybe for the last 5 to 7 years. It's increased a little bit more in popularity. And it's basically not controlling so much what you eat, but when you eat. And there's different versions of it. There's alternate day fasting. There's like a 16 and 8, so it's just a controlled daily fast. There's the 5-2-5. There's the eat, stop, eat. There's so many different things. And what we've seen in the research is that all of them have a lot of really great benefits: weight benefits, heart benefits, cancer prevention, diabetes. There's a lot of things that it really helps.
So given that there's a lot of options, what do you normally recommend someone try if they're just trying it for the first time?
So one of the things that I try most often is just to help them understand what it is. Fasting is something that's been done for a very long time in a lot of different places. There's a lot of religious fasting versus diet fasting. And so just trying to understand what it is and how we're doing caloric restrictions, the first step. And to really encourage them to read about intermittent fasting, because there's a lot of really good information on the internet. But then to say, all right, let's try this out. If you're a fasting novice, can you go 12 hours without fasting, without eating any calories whatsoever? And so I generally like to start off with a 3-week lead up. So week 1, don't do it on the weekends. Make sure that this is something that we can do. Just fast for 12 hours, no calories. And then the next week, 14. Week after that, 16 hours a day for 5 days a week or so, just to find out where they land, what their body can handle, if they need that extra, something, a little snack in the morning or not, and then just kind of see where we go from there. That's generally what we start with first.
Okay. And then how long should somebody be doing that before they consider switching to a different regimen?
Once we figure out an hourly regimen, and the ideal range is to get to that 16 hours of fasting. So I like to think of intermittent fasting, I'll explain it to them too, in that there's 3 different components of intermittent fasting. There's the hours that you're fasting, there's the hours that you're eating, and there's what you do in between both of those times. So in that 16-hour fast, we don't want any calories, but you can still have, things like erythritol or stevia, some artificial sweeteners in your coffee or tea, and water, just as long as there's no calories. And then, it's good to exercise inside that time. And then in the eating window, are you practicing any kind of caloric restriction? Are you cutting out, a liquid calorie? Are you, doing a Mediterranean diet or a keto diet or a Colorado diet? And so we experiment with all those times, and ideally we like to get to 16 and 8, so 16 hours fasting with an 8-hour eating window. And then we'd like to try that for a few months before we change regimens around, because that's where we'll really start to see those benefits. And with just weight alone, you can almost get off maybe 15% of your excess weight just with intermittent fasting.
Over a 6-week period of time? Or?
Usually after, between the studies are up to 24 weeks. So somewhere between that 8 to 24 week mark, somewhere in that range is where most people fall.
Okay, great. So one of the things that I know intermittent fasting is supposed to help is inflammation.
Yes.
There's a lot of information about people that just don't feel good that might be attributed to some kind of inflammation. Can you describe maybe some of the science behind inflammation, or just what you found in your research that might be helpful for viewers?
So there's a lot of folks that have been doing it for about 7 years, and I can speak even personally, it's something I practice daily. I intermittent fast most days of the week. Maybe I'll take 1 or 2 days off a month. And what you find is that your body's enzymes, what it does is it increases certain enzymes and decreases other enzymes that are involved in either inflammation or your body's regenerative capacity. And that's where it looks at inflammation the most, is being able to rid your body of cellular debris and that allow your body to function better. And there's a bunch of chemicals involved and a lot of different stuff. We could get really into the weeds, but for the most part, it helps decrease the amount of debris inside your cells.
Okay.
Yeah.
And the last thing I'd like to ask you about is the anti-aging. Again, a lot of people have read about that and just how it kind of changes the way your cells function. Can you describe maybe some of that?
Yeah, so when they look at things that prolong age, they've seen that starvation diets or severe caloric restriction of 600 calories or less a day does, on average, increase the telemetry or the telomeres on your cells that are part of our aging process. And intermittent fasting is the only other thing that they've found now in terms of what we can do with diet and exercise that does that same thing. And again, has to do with being able to rid the body of cellular debris, decrease the oxygen, it increases your ability to repair certain things, gives your better oxygen saturation of your cells, which allow for, resistant things that, your body's trying to fight. And that's why that works as well.
Great, awesome. Great, well that's all the time we have for today. Dr. Tann, thank you for joining us today. If you'd like more information, please check out our website at menorahmedicalcenter.com. Thank you.